Welcome, everyone, and thank you for joining us today. We will wait a minute to allow others to log on. Wonderful. Welcome, everyone, to today's webinar. We are exceptionally glad that you are here to join us. Today is an all-sector telebriefing focused on helping you navigate the upcoming changes to the CalFresh and Medi-Cal benefits. My name is Ramona Prado-Lyon, and I'm with the County of San Diego Health and Human Services Agency, Department of Strategy and Community Engagement. I'm honored to be your moderator. We are going to provide an overview of some upcoming changes to CalFresh and Medi-Cal benefits to help you navigate this process. We will focus on who may be affected by these changes and what you can do to stay informed and access additional resources. Many people will not be affected by these changes. However, we know that information about benefits can be overwhelming, so our goal today is to walk through it together and give you some clear steps to take after the presentation. Our team is here to support you, provide clear information and resources, and help you feel confident in sharing these updates with the communities you serve. Together, we can make sure individuals and families stay informed, stay connected to the benefits they qualify for, and receive the support they need. Thank you again for being here and for the work you do every day. So here's what's on the agenda. First, we will hear a presentation focused on the CalFresh and Medi-Cal changes. Next, we will share resources to support the community. After the resources, we will have a Q&A session. And lastly, we will ask for your feedback on today's webinar. So let's get started. It's great to see everyone here with us. Please say hello by adding your name and organization to the chat box. A few reminders before we begin. This webinar is being recorded and your lines are muted. Additionally, AI note takers are not allowed. Please remember to submit your questions in the Q&A box, which is a button at the bottom center of your screen. We will do our best to answer your questions in the box today. We will also be sending out answers to questions and a follow-up email. So your speakers today will be me, as well as Ricardo Hernandez and David Sagaz from the County of San Diego Self-Sufficiency Services. Thank you both for being here today. As I mentioned, we will provide an overview of some upcoming changes to CalFresh and Medi-Cal benefits to help you and your clients navigate this process. We will do our best to answer your questions at the end of the presentation, but please know that we are not eligibility service workers and we cannot provide specific answers about someone's eligibility. We will provide you resources and contacts to help get the answers you and your clients need. Please note that guidance is still evolving and may not be up to date if this presentation is watched at a later date. For the most up-to-date guidance, please refer to the websites of the California Department of Social Services for CalFresh and the Department of Healthcare Services for Medi-Cal. We will share links at the end. There are a couple more key points to share as we begin. First, these are some of the biggest federal changes to Medi-Cal and CalFresh in decades. A top priority is clear, consistent messaging, so we appreciate the opportunity to share today. Second, the county is here to help. For the past year, we've been planning and responding to HR 1 with the goal of keeping our community connected to benefits. Third, it is important that customers keep their contact information updated and respond to the county. While we would do everything we can to remove barriers and reach people, at the end of the day, our customers need to take action to get or keep benefits. And lastly, while these changes are immense, most people will be able to keep their benefits. That's why a top priority is to help people identify their exemptions and provide resources. If you take away anything from today, it is that each individual and family is unique, and it is very important to work with county staff to understand the rules and check your eligibility. The last thing we want is for people to assume they are no longer eligible for assistance. The best way for customers to prepare is to know your renewal month, make sure your contact information is up to date, and if you were impacted by these changes, you will be contacted with more information. Phone numbers and links are at the end of the presentation for people to check their information. I'll now pass it over to Ricardo, my colleague from Self-Sufficiency Services, to go through the changes in greater detail.
Thank you, Ramona. In this slide, what we're going to see is what is changing based on House Resolution 1 or HR 1, also known as the One Big Beautiful Bill Act. It was signed into law as of July 4th of 2025. The law includes changes to CalFresh and Medi-Cal for some individuals. So what we see here is just a very simple high-level timeline of what the provisions are going to implement or have been implemented for both programs. So we can start with CalFresh. The CalFresh changes include as of April 1st of this year, some groups of non-citizens were no longer eligible to enroll or continue benefits at their next renewal. As of June 1st for CalFresh, there are new work requirements for some able-bodied adults without dependents or ABODs to get or keep CalFresh. Now, ABODs you might also know as that, able-bodied adults without dependents, or the term CalFresh work requirements. They're all interchangeable and refer to the same policy. For Medi-Cal, as of January 1st, 2026, enrollment was frozen for new applicants with unsatisfactory immigration status. This primarily affected undocumented individuals. And then later this year, on October 1st, 2026, the federal government is changing how it defines certain non-citizens, making some individuals ineligible for federally funded Medi-Cal. These individuals will switch to state-funded or full-scope Medi-Cal. And then starting in January of 2027, there will be work requirements for Medi-Cal, and Medi-Cal renewals will be required twice as often for certain adults. So that is the outline of our CalFresh and Medi-Cal HR1 provisions that have implemented or will implement. Next slide, please. So first, we're going to start with some CalFresh changes. Next slide, please. CalFresh implemented, like I had said before, on April 1st, 2026, the changes for non-citizen eligibility. So as of April 1st, 2026, some non-citizens are no longer eligible to receive CalFresh. In the county of San Diego, this was estimated to impact around 13,000 folks. Next slide, please. Now, let's discuss the policy and who is still eligible for CalFresh. So as of April 1st, customers are eligible for CalFresh if they fall into one of the following categories. One, they are a U.S. citizen. Two, they are a U.S. national. Three, a lawful permanent resident, and sometimes this category is referred to as an LPR or a green card holder. Four, a Cuban or Haitian entrant, and this is defined under the United States Citizenship and Immigration Services category and definition. And lastly, they are a Compacts of Free Association citizen, or COFA. And COFA includes Micronesia, Palau, and the Marshall Islands. So what the change of policy did is prior to April 1st, 2026, other non-citizen categories were eligible, or other citizenship categories were eligible as of April 1st of this year. These are the 5 categories that would be eligible or potentially eligible to federally funded CalFresh benefits. Next slide, please. Now, in looking at who became ineligible, so for federally funded CalFresh benefits as of April 1st, 2026, these categories of non-citizens, these individuals are no longer eligible. So that includes asylees, refugees, parolees, unless they are Cuban or Haitian entrants. And when we say a parolee or somebody who has parole, in this context, we're referring to immigration status, not through the criminal justice system. Also, individuals with deportation or removal withheld, conditional entrants, victims of trafficking, battered non-citizens, and Iraqis and Afghans with special immigrant visas or SIVs. And then, as identified on this slide, some Afghan nationals or Ukrainian nationals granted parole within the identified dates on this slide. So those are going to be the changes to CalFresh citizenship. Excuse me. And these were implemented as of April 1st. So anybody applying for CalFresh as of April 1st, 2026 is going to be subject to this citizenship change. And for folks who were already receiving CalFresh, it is going to be starting with households that have their renewal due in April of 2026. And every month thereafter will receive the screening under the new HR1 policy. Next slide, please. The next provision for CalFresh that was implemented in 2026 is regarding the able-bodied adults without dependents, or again, ABOD, time limit policy. So as of June 1st, the work requirements began for some 18 to 64-year-olds unless they meet an exemption. Now, there's many exemptions, and we're going to have a slide that covers them, but this also includes having a child or having children under the age of 14 in the CalFresh household, or for those who are physically or mentally unable to work. Now, the County of San Diego is estimating about 93,500 residents are going to be impacted by this policy change. Next slide, please. For the CalFresh work requirements, the policy, before we get into some of these details, looks at the adults that are 18 to 64. If they do not meet an exemption, then they are able to receive 3 full months of CalFresh benefits in a 36-month period. The 36-month period is a statewide 36-month time clock in California. All 58 counties are aligned to it. And the time clock began on January 1st of 2026 and would run through December 31st of 2028. The 36-month time clock is going to reset in the beginning of 2029. Now, the CalFresh work requirements are looking at folks who do not meet an exemption. Then they do have to meet a work requirement to continue to be eligible for CalFresh outside of that 3-month time limit. So the exemption for not having children under the home, for example, would allow those folks to continue receiving CalFresh beyond the 3-month time limit. Also, people who need to meet the work requirements include those who are physically and mentally able to work and who do not meet any of the other exemptions. Now, if somebody is not exempt from the work requirement, then they can complete these work requirements by any of the activities listed below, by doing 20 hours a week or 80 hours a month of work, which can be paid work, it could be unpaid work, for example, in kind, it can be self-employment, it could be training, and it can be volunteering. Now, somebody may work, for example, 5 hours a week, and they can volunteer for 15 hours a week, complete that 20-hour-a-week requirement. So it isn't any one particular, it can be combined, and the activities can help the individual complete that 20-hour-a-week or 80-hour-a-month requirement in order to continue receiving CalFresh benefits beyond the 3-month limit within the 36 months. Next slide, please. Now, this slide goes over all of the potential exemptions. So again, very similar to how non-citizen policies were rolled out, applicants as of June 1st and households that were already receiving CalFresh with their renewals as of June 2026 will be evaluated under this policy. So the rule of these work requirements will not apply to the folks that meet any of the following exemptions now that the policy has been implemented, or re-implemented, I should say. The rules will not apply for those who are under 18, over 64, pregnant, who have a child under 14 in the CalFresh household, who are physically or mentally unfit to work, who attend Office of Refugee Resettlement or ORR training programs at least half-time, who identify as Indian, Urban Indian, or California Indian under the Indian Healthcare Improvement Act, who are disabled or are caring for a person with a disability, who are receiving or applying for unemployment or disability benefits, who are attending school, college, or training program at least half time, who are meeting the work requirements for CalWorks, or who are in a drug or alcohol abuse treatment program. So these are going to be the exemptions that our eligibility staff here with self-sufficiency services will evaluate for as we look at new applicants as of June 1st or recipient households at their next renewal starting in June and moving forward. And that gives a summary of the CalFresh work requirements. Next slide, please. And I'll go ahead and turn it over to David for the Medi-Cal portion. Thank you.
Now we will shift to the Medi-Cal changes. Medi-Cal is California's Medicaid program. It provides health care to more than 14 million people with low income, or around a third of all Californians. As with the CalFresh changes, each situation is unique and will need to be confirmed by speaking with the county. Next slide, please. Though we are waiting on several decisions from the state government, we want to discuss potential impacts to Medi-Cal recipients. Regarding non-citizens, as of January 1st, 2026, Medi-Cal enrollment was frozen for new adult applicants with unsatisfactory immigration status. This primarily affected undocumented individuals. As of October 1st, 2026, the federal government is changing how it defines certain non-citizens, making some individuals ineligible for federally funded Medi-Cal. The state has opted to provide these individuals with state-funded full-scope Medi-Cal. In January of 2027, both undocumented individuals who were grandfathered into full-scope Medi-Cal and remain on Medi-Cal, as well as individuals affected by the federal redefinition of certain immigration statuses, will switch to fee-for-service Medi-Cal and will no longer have a managed care plan. Approximately 67,000 impacted individuals in San Diego County will be affected by these changes. Next slide, please. Starting July 1st, 2027, only these individuals on this slide will continue to be eligible for federally funded full-scope Medi-Cal. Currently, undocumented adults who enrolled or applied by December 31st of 2025 can keep their Medi-Cal, their full-scope Medi-Cal if they continue to qualify. It is anticipated that with this change, it may remove them from eligible groups. All undocumented adults can still qualify for restricted scope, also known as emergency Medi-Cal. Next slide, please. Starting on October 1st of 2026, the following groups on this slide will no longer be eligible for federally funded full-scope Medi-Cal. They will receive state-funded full-scope Medi-Cal through the rest of 2026. On January 1st, they will transition to fee-for-service Medi-Cal, which means they will have no managed care plan. Next slide, please. On January 1st, 2027, some Medi-Cal adults aged 19 to 64 without dependents will be subject to new work requirements. Eligibility will need to also be checked twice per year for some adults, an increase from the once-a-year checks that happen now. Additionally, retroactive coverage will be limited to 1 or 2 months prior to the application from the current 3 months of retroactive coverage. Next slide, please. Let's take a closer look at the Medi-Cal work requirements. Unless someone meets an exemption, adults 19 to 64 who received Medi-Cal through the Affordable Care Act expansion will need to participate in one of the approved activities listed here for at least 20 hours per week or 80 hours per month, or they must earn more than $580 a month. This can include having a job training, community service, or volunteer work, or some combination of those activities. Non-exempt individuals must demonstrate compliance with work requirements in the month before Medi-Cal enrollment. Next slide, please. Work requirements may not apply to people with these exemptions listed on the slide. Please note that the state has yet to provide any final guidance defining medical frailty. And next slide, please. And next, I'll turn it over to Ramona, who will give you some recommendations on what customers and organizations can do to stay enrolled.
Thank you so much, David and Ricardo, for that very informative presentation. These are complex rules, but there are very simple ways that customers and all of you can do to take action. To start, the County of San Diego is partnering with 211 San Diego to provide a one-stop shop for connections to resources for work programs, job training, and education and volunteer programs to help individuals meet the new requirements for CalFresh and Medi-Cal. Individuals can access the Work Ready Hub by calling 211, scanning the QR code, or clicking the link in the chat to get connected for your clients. What should you or your clients do next? The most important takeaway is that if your clients are impacted by any of these changes, they will be contacted or informed during their intake interview or next recertification. So it is very important to keep their contact information updated so they can receive any notices and outreach. They can visit their Benefits Cal account to make sure their email, phone number, and address are all up to date, and also check the renewal recertification month. For more support, they can also go directly to a family resource center or call the Access customer service line. We've also linked our website that includes more information about the changes that are coming. They can also email any documents and request to update their information by emailing dpc.hhsa@sdcounty.ca.gov. However, it is better to update information through the Benefits Cal account. Once their contact information is updated, be sure they check their mail and respond to any communications from the County of San Diego, including phone calls, texts, and emails. County staff will be reaching out in multiple ways, and this is how they will learn if they're affected by any changes from HR 1 and what, if anything, they need to do next. As an organization, what should you do next? If your organization supports people that may be impacted by these changes, here are some important links. If you need enrollment support for your clients, see if your organization is a good fit for the Access CBO line, which is a line available for community-based organizations to call and speak with a live agent to get general information, check on case and eligibility status, and much more. Organizations can request a Live on Wheels with self-sufficiency to attend events. If you have job or volunteer opportunities, San Diego Workforce Partnership and Hands-On San Diego are great places to list them. You can also request a presentation like this one for community or staff. There are tools and templates being created to support you in supporting the community. We will be updating the CalFresh Medi-Cal Changes Toolkit frequently. The General Partner Resource Toolkit is also listed for general self-sufficiency tools and templates. This presentation and these links are available in the CalFresh Medi-Cal Changes Toolkit listed at the bottom of the blue bar and in the chat. The Changes webpage is updated as we learn more information. As I mentioned, County of San Diego is partnering with 211 San Diego to provide the one-stop shop for connections to resources for work programs, job training, and education and volunteer programs to help your customers meet the new requirements for CalFresh and Medi-Cal. You can add your work programs, job training, education, and volunteer opportunities to your service listings so that customers can connect with your organization in this way. And to increase access to food resources, the County of San Diego is expanding free food distribution at 6 community locations. This is in partnership with Jacobs and Cushman San Diego Food Bank and Feeding San Diego. There are no income or residence requirements to receive food. Please note that the schedule is subject to change and currently tentative. To learn more, visit the QR code on screen or visit the link in the chat. Whether or not these changes impact you, there are many resources out there and we are here to help you navigate them. Visit the self-sufficiency webpage to see all programs available. 211 San Diego is a great place to go for a variety of resources. You can search for job and volunteer opportunities to meet work requirements, as well as get connected to food resources. And finally, the San Diego Hunger Coalition, San Diego Food Bank, and Feeding San Diego all have food resources available. You can scan the QR codes for more information. Any of them work on the screen. We hope that this information and these resources will help you navigate these changes. The most up-to-date information and guidance regarding the upcoming changes to CalFresh and Medi-Cal benefits, please refer to the websites of the California Department of Social Services for CalFresh and the Department of Healthcare Services for Medi-Cal. Links are on the slide and in the chat. Now we have some time for questions, including questions submitted during registration. Please continue to put your questions in the Q&A box and we will answer them as we have time. So I will invite David and Ricardo to come back on screen and we can start with some of our questions. Thank you both. So I have a first question regarding, let's start with CalFresh. Got them categorized here on the back end, so let's start there. First question is an individual's monthly income total after rent, is that deducted? Or is the monthly income the entirety of their income prior to rent?
Thank you for the question. The calculation of CalFresh benefits does consider a household's total gross monthly income and allowable expenses. So rent is part of the budget calculation and may help lower the countable income and increase CalFresh benefits.
Awesome. Thank you. Okay, getting into some Medi-Cal. How will medical and disability accommodations be changed?
So at this time, our accommodations are not changing. We still try to accommodate our customers with medical or disabilities as much as we can, as much as possible. So those are not changing. What will be changing is once the state gets into defining what medical frailty is for the work requirements, that's when we may see some of the changes into how we will accommodate the population. But at this time, we are still waiting on additional guidance from the state.
Okay, great. Thank you, David. And kind of a deviation to that question then too is, can you discuss some Medi-Cal waivers and any impacts come from there?
So currently, we do not expect any impacts to our home and community-based services waivers. These individuals who are part of the waiver programs are not subject to the work requirements at this time or the 6-month renewal. So we don't anticipate any impacts to them.
Thank you. And I have another question then here about Medi-Cal, but more for the billing side and more for organizations providing support. So how do these changes affect billing for CHW or peer support services?
So unfortunately, at the county level, we do not have any information regarding impacts to billing, particularly for Medi-Cal. Billing is directly done by the Department of Healthcare Services at the state level. Providers with any questions regarding Medi-Cal billing and potential impacts may reach out to Medi-Cal billing at 1-800-541-5555.
Thank you, David. Okay, now I have questions for both of you, for both CalFresh and Medi-Cal and the impacts there. Um, how do you see these updates impacting clients who currently receive both CalFresh and Medi-Cal benefits?
Thank you for the question. I can answer for CalFresh and then defer to David for the Medi-Cal portion of it. For CalFresh, if we are talking about recipient households, those households will be evaluated for both the non-citizen changes and for the CalFresh work requirements at their next renewal. So that's when the HR1 policy provisions will be evaluated for those recipient households. I'll pass it over to David.
So for Medi-Cal, current beneficiaries will be rolled over into their 6-month renewal at their next regularly scheduled renewal in 2027, at which time they will also be evaluated for work requirements. For any new applicants as of January 1st, 2027, they will be evaluated for work requirements at the time they apply for Medi-Cal. And at this time, just a caveat that we are still waiting for finalized guidance, so some of this information may change.
Okay. Great. Thank you both for that. Another question we have is, will there be any delays and benefits that we should prepare clients for?
Great question, and I think I might be able to speak for both programs. We don't anticipate for either CalFresh or Medi-Cal that there will be any impact to our service delivery for clients.
Okay. Good to know. Really do appreciate that. One of my final questions is, how do beneficiaries confirm their specific benefits for both CalFresh and Medi-Cal? Do they receive a summary of benefits and coverage once they sign up, like with private health insurance, or is there some other notification that they are provided?
Thank you again for the question. For CalFresh, a notice of action, sometimes we refer to it as a NOAA, notice of action, is sent to all households once the application processing is completed. And then that notice of action informs households that their application has been approved, and it also provides information regarding their CalFresh benefit levels.
And then for Medi-Cal, a notice of action is also sent to every household upon approval, letting them know their benefit levels and whether or not they have a share of cost with their Medi-Cal. Customers, in addition to that, will also receive information from the HCS, the Department of Healthcare Services, regarding their choices for managed care plans and also their benefits.
Okay. Great. Then I think we have time for one last question just to kind of round us out and reaffirm some information that was presented. We do have a few questions about impacts to older adults and undocumented individuals. Can you confirm the changes that might be expected for these groups?
Thank you for the question. For CalFresh, I can chime in on this. For the CalFresh side of the benefits, so individuals who are undocumented are currently ineligible for benefits and would continue to be ineligible for CalFresh benefits. For older adults, the work requirements raise the age exemption to 65. So anybody 65 and older would not be subject to the work requirement for CalFresh.
And for Medi-Cal, we are still awaiting some more guidance on impacts to older adults. For undocumented individuals, as long as they were enrolled in Medi-Cal and receiving Medi-Cal without a break-in aid exceeding 90 days, as long as they enrolled before January 1st of this year, 2026, they would remain in full scope. They will just be losing that managed care plan come January 1st, 2027. And then for our work requirements, anyone over 65 and over would also be exempt from our work requirements.
Okay. Great. Thank you both for that. Really appreciate reaffirming the information presented. Appreciate your time. That's all the questions that we have time to answer today. So we're gonna keep moving on, but I really do thank you for your time today. And for those of us here, please provide your feedback on our presentation today by using the QR code on the screen or clicking the link in the chat. Your feedback helps us improve our outreach and support. As always, you can stay up to date with all of our information and webinars and resources like this one today by visiting the county website on the CalFresh and Medi-Cal changes and subscribing to our newsletter. All of the links are in the chat. So appreciate everybody here. That's all our time together today. Thank you again for joining us, and we hope to connect with you soon.